So we're going to demonstrate pulleys. You'll receive some pulleys in your shoulder kit. You want to take the tab of the pulleys, put it over the top of your door, and then close the door on it. Initially, you want to start with facing the door until you can reach 90 degrees easily, and then we'll show you what you can use them for after that. So you're going to go ahead and grab onto the pulleys. You want to use your non-surgical arm to do the work. The other one is just holding on for the motion. So you want to make sure that you have your arm directly in front of you and your thumb is oriented up, and then go ahead and pull down with your left arm to bring your arm up over your head. Whenever you do this, you may see that your elbow is trying to come out laterally. You want to make sure that it will try to come in this direction. You want to make sure that it stays directly in front of you. Take it as much as you can tolerate it. Hold it there for a count of 10, and then use your left arm or non-surgical arm to slowly lower it back to the starting position. Let's try that again. So come in front of you, keep your elbow in, go up, hold for a count of 10, and then let it come down. You can complete this with your elbow bent, or you can also take your chair a little bit further away and do it with your elbow extended. Okay. We're going to demonstrate pulley flexion at greater than 90 degrees. So whenever you complete this, you want to make sure that you use the non-surgical arm to do the work and let it passively move the surgical arm. So we're going to go ahead and use your left arm to pull you up into flexion. You want to make sure that your elbow stays directly in front of you. Don't let it laterally deviate. Go ahead and return it. And then use the non-surgical arm to slowly return it to the starting position. You can complete the pulleys with either your elbow flexed or extended. So we're going to go into extension, thumb pointing up, use the left arm or the non-surgical arm to pull the surgical arm up slowly. Hold there for a count of 10, and then go ahead and lower back down to the starting position. So this is going to be Thera-band external rotation. You want to start by placing a towel under the elbow and then pressing your elbow into the towel to keep the elbow at your side. You also want to make sure that your shoulder is in a neutral position, not too far forward, so you might want to retract your scapula. So then you're going to keep your elbow at your side and then externally rotate, hold for a count of 5, and then return to the starting position. Two things you want to be careful not to do is, one, extend your elbow because this isn't doing anything for the shoulder. And you also want to make sure that whenever you come into external rotation that you're not turning your body into it. You want to keep your body neutral as well. So this is going to be Thera-band internal rotation. You want to start by placing the towel under your elbow and then pushing your elbow into the towel. And then you're going to pull your palm in towards your stomach. Hold there for a count of 5 and then come back to the starting position. Something that you want to pay attention to whenever you're completing this is you don't want to let your shoulder glide anteriorly. You don't want to pull it forward like that and then come out. Make sure that you keep it in a neutral position and then go ahead and pull in and then return to the starting position. So we're going to complete Thera-band extension. In your kit, you will find the Thera-band. You're going to take the tab, close it in the door, make sure it's secure before you pull on it. and then you're going to go ahead and step back until you have some resistance on the band, and then you're going to bend your elbow, bring your elbow just to your side so that your humerus is not coming anterior. You're going to hold for a count of 5 and then return to the starting position. So this is going to be low row with the T-band. So you want to hold on to the handle, palm facing down. You're going to pull back until you're at your side. Don't come past your side so that the humerus is not coming too far anterior. You're going to hold for a count of 5 and then return to the starting position. So we're going to complete resisted bicep flexion. Whenever you do the resisted bicep flexion, you want to retract your scapula to put your shoulder in a better position. You want to stabilize your elbow at your side, and then palm facing up, you're going to go ahead and flex at your elbow, come up, hold for a count of 5, and then just extend your elbow and go to the returning position.